On May 9th, 2016, the Registered Nurses Association of Ontario released a document by the name of Mind the Safety Gap. The report was seen by many, and I'm not just talking about practical nurses, but many in the healthcare system as a full-out attack on registered practical nurses. Their work, especially their work in acute care, where they are providing excellent care to a certain portion of patients every day. While this document created by RPNAO may have felt terribly uncomfortable during Nursing Week, and it did to many that we've heard from, I think what I would really like the Practical Nurses of Ontario to know is the degree to which people have come out to support us. Nurse leaders, registered nurses, registered practical nurses, people from other professions, the nurse practitioners. So many people have contacted us since the release of this report to let us know that they do believe we have a role in acute care, and they do believe we're of value in every sector. And if nothing else, you should take some encouragement from the fact that if you're an RPN in Ontario, your value is understood by more than just your RPN colleagues, but by a broad cross-section of people who you work with every day. But what I would like to talk about is some of the inconsistencies in the report and some of the things that are unclear and some of the things that I believe are misleading. When I see a situation where we look at the number of registered nurses and then say there's not enough because of how many registered practical nurses there are, it just doesn't make any sense to me. The report also does a comparison of growth in the province, growth of positions. And what they call it in this document is shares of nursing, but with no real definition of share. Does it mean positions? Because if it means positions, it's apples to oranges. From RNs to RPNs, we have a much lower full-time rate, so our positions tend to be more likely part-time positions. It makes it very difficult then to have that comparison, so I'm not sure what they mean by share. I'd like to talk a little bit about the recommendations. The Ministry of Health needs to develop a provincial evidence-based interprofessional HHR plan to align the population healthcare needs with the types of care providers. I agree. It is time to come up with a plan for how we're going to ensure that there are enough nurses in the future. But that plan can never be made in isolation of all of the nursing groups that are involved. All of us have expertise about our category of nurse, and to suggest, as it does in this document, that this should be the building block for the nursing portion of that would be wrong on so many levels, because there's so much to consider in terms of the nurse practitioners, the registered practical nurses, and certainly nobody's going to create an HHR plan consulting with just one group. We need to do that with everyone. The document is very contradictory in so many ways. Recommendation number 2, that the Ministry of Health and the LHINs issue a moratorium on nursing skill mix changes until a comprehensive interprofessional HHR plan is completed. And yet, on the very next page, this document suggests sweeping skill mix changes, immediate sweeping skill mix changes. LHINs mandate the use of organizational models of nursing care delivery that advance continuity and avoid fragmented care. Throughout healthcare in Ontario right now, models of care delivery that have been tried in the past, all of them, including primary care nursing, have had some level of problems, and in order to create flexibility and responsiveness, nursing leaders are developing new programs. And to suggest that nursing leaders who are advanced practice nurses do not have the skills to develop nursing programs is offensive to so many. But I think it is time to engage in innovation, and if that looks like a new model of care delivery, and we base it off careful planning and building careful structures, I don't think the word experimentation, which we see in this document, is appropriate. There's one other important point there too. In some of the webinar educational tools that RPNAO has been using, they talk about having PSWs work with RNs in certain situations, and they don't identify which. I'm assuming acute care, but the PSWs are an important part of the team, a very, very important part of the team. But when they work with registered nurses, it's a form of team nursing. And the leader of RPNAO, I just saw her tweet out actually an excellent article about when nurse practitioners work with physicians and how physicians can take care of certain high-level pieces of the practice, and nurse practitioners who are autonomous practitioners and decision makers can work with the rest of the patient needs that are within their scope of practice. That is exactly the same sort of thing that we're talking about with registered nurses and registered practical nurses, and that we've been doing for some time. Number 4, that the Ministry of Health legislate all RN workforce in acute care, effective within 2 years for some hospitals and within 5 years for basically the rest. When I look at the patient population in acute care, there is a large number of them that require RNs, and they have them. About 80% of nurses, generally speaking, over the past few years have been nurses in acute care, have been registered nurses. It's appropriate. But there's many patients in acute care. There's well moms and well babies. There is complex continuing care. There's rehab. There's any number of less complex surgical patients who absolutely are well cared for by registered practical nurses, especially with the growing knowledge base that registered practical nurses have today. Many nurse leaders contacted me after this document came out to say that their registered practical nurses were providing excellent care in their acute care environments. Number 5, that LHINs require all first home health care visits to be done by an RN. That is a good idea in terms of the patients who require an RN level of assessment and in their first visit. That brings us to the very basic problem with this whole document, is that there has to be a professional practice decision-making about care provider. We have to decide from a professional practice basis what patients need, and then we have to find the right care provider. To legislate or make rules about it has to be one or the other would remove the very flexibility that the patient's first documents are recommending that we engage in to meet the needs of the healthcare population in the future, and the full scope of practice of all healthcare providers. Number 7, the Ministry of Health legislate minimum staffing standards in long-term care homes. 1 attending NP per 120 residents. That's a great idea. 20% RNs, 25% RPNs, and 55% personal support workers. It's interesting to me that this was presented in percentages, so in ratios to each other, rather than numbers of care providers for a patient population. We've got a situation in long-term care where the workloads are intense. The funding does not allow for a great deal of flexibility. We need everyone there. Our personal support workers are a big piece of the quality of care in our long-term care. Certainly the amount of care that happens. They're not nurses, but they're excellent care providers alongside with us. Why we would limit them, I don't know. But this whole recommendation, I have a concern about the fact that we're not talking about the amount of care, that we're only talking about the ratio of care providers to each other, which makes me feel like it's not about patient care. It's an uncomfortable recommendation for me, and I worry about it. In terms of reclaiming the RN role, I'm very uncomfortable with the way that that's being done. I don't think we reclaim our role, any of us claim our role by limiting another. I think practical nurses have a scope of practice. We need to allow them to work to their full scope of practice every day. There's a fairly rapidly growing shortage of registered nurses in the system, and I think it's something that everybody has to be invested in solving. But you can't solve the problem of registered nurses by limiting another group from their full scope of practice, or for their growing numbers when those growing numbers are needed to care for the patient populations best suited to them. There is a right way and a wrong way to ensure the strength of our particular categories of nurse, and holding back another group from practicing the way they are educated to practice in order to try to promote another group is erroneous. And I think what we need to do is really work to ensure that there is enough registered nurses, but that RPNs also work to their fullest scope of practice every day in the healthcare system. And that will give us the flexibility that the patient's first documents talk about, and it'll give us the patient satisfaction and the nurse satisfaction to work to their full scope of practice. I think it's important to remember that we're stronger together.